Hello, today I'm being joined by Dr. Samantha Pfeifer from Weill Cornell, who is a reproductive specialist based in New York. Hi, how are you?
Hello, Eloise. How are you? I'm so happy to be here today.
It's great to be chatting with you to do another round, I guess, of true or false fertility facts versus fiction. And we have some very interesting questions, don't we, which I've already shared with you, which cover a lot of different types of topics.
All of them very relevant. Some of them funny, but relevant.
And I'm sure many people who are watching will be glad to hear some of the answers because it will be things you're thinking, but you may not want to ask or may not have ever had the opportunity to ask. So let's start with the more medical based ones and then we'll move on to more lifestyle.
Got it. Yeah, that should be fun. I'm looking forward. I love doing these sessions. These are really kind of quite really enjoyable. So
Good. Thank you for being here. Can sperm quality affect the number of embryos and the implantation rate?
Well, interesting. This is a very interesting question. As you may know, my husband is a urologist. And so I was going over the questions and I said to him, how would you answer this question? Because it's a really good question. And in his typical way, he said, yes. However, and I think it's yes, it can, but we really don't understand all the mechanisms that can lead for that to happen. So I think, certainly with lower sperm numbers or motility, fertilization rate can be affected. So that could affect, lag time to achieve a pregnancy naturally, or even with IVF, a lower fertilization rate. And that one is fairly obvious, but it's not clear that low numbers of sperm actually affect quality of embryos. Okay. But other things with sperm potentially could affect that. And one of them is a newer thing that we've just been looking at over the last several years, which is DNA fragmentation. We know that that can affect the quality of the sperm, but we really don't know how it plays into embryo quality or outcomes per se. So we know that that is something that still needs to be evaluated, but maybe a factor for some individuals, clearly not everybody. And then other things can be, the age of the male. We know that the age of the male can be associated with higher risks of autism and other autosomal dominant mutations. And so that men over 50 may be more prone to things like that. And usually it's about twofold increase, or about 2% increase, 2% risk. So those are things that we know can potentially affect outcomes, but we don't really know the mechanism. And a lot of these things still have to be evaluated. But I think it's fair to say that it's not just the woman. I always view fertility as a team sport. And, both partners are equally responsible, if you will, for the outcome. So it's never shared by just one individual. It's always two. So I think to view it like that is important. Mechanisms, we're still sorting a lot of that stuff out.
Absolutely. Thank you. That's a very good answer. Can you boost egg quality after the age of 35?
That's a good question. I think people are very fixated on ovarian reserve and egg quality. I think that we know the bottom line is probably no. But egg quality after 35 is not necessarily bad. We know that women are born with the most eggs they're ever going to have. And over time, that number declines. But we also know that the age of a woman also has an impact on which embryos are more likely to be successful. To our knowledge, really, there's nothing we can do to improve egg or embryo quality at any point in time. There's a lot of things out there that can potentially improve embryo quality, or egg quality. And people have talked about CoQ10 and DHA and all of these other things, acupuncture. Although there are several studies saying that there may be a benefit, the data are not conclusive or good to say that these things actually make a difference. So I think that there really is not anything we can conclusively do to improve egg quality or embryo quality after age 35. But I think it's good to say that just because an individual is 35 doesn't mean she has bad embryo or egg quality. So I think those are things I would think about with that question.
And if those things that haven't been proven to necessarily help aren't detrimental, can people perhaps try them if they want to give it a go, to put their mind at ease that they've tried other things?
Absolutely. Yes. I mean, there's no harm in DHA. Sometimes it can, too much DHA may be potentially an issue, but I think that all of these other things are adjuncts that have no harm associated with them. I think it's important to know that yes, you can take these things. There's no proven benefit, but to think, okay, I'm not doing any harm by doing this certainly is a very reasonable approach, because you want to feel like you've done everything you possibly can. So these things aren't detrimental.
Can hydrosalpinx cause miscarriages if the fluid is more towards ovaries?
I've had to laugh with this question because it's a good question, because hydrosalpinx is fluid that's trapped in the fallopian tube, typically because there's a blockage at the end of the fallopian tube. And so fluid can accumulate there. And hydrosalpinx has typically been associated with a lower pregnancy rate with patients undergoing IVF. And the thought is that the fluid can wash back from the fallopian tube into the uterus and potentially flush that embryo out. Or some people feel the fluid may be sort of toxic and lead to an adverse impact on the embryo. So in that situation, hydrosalpinx can be detrimental. Once an embryo has attached, it's not anything to suggest that the fluid can be detrimental to the embryo once it's attached. So no. The reason I sort of thought I had to sort of laugh a little bit is because there's so much information out there that patients are told that it's very easy to confuse things and to attribute something to something else. So I think to clarify why the hydrosalpinx can potentially be detrimental is important. So not for someone who's already pregnant, it's really in the process of getting pregnant. And the other interesting thing is that a hydrosalpinx, if you have one hydrosalpinx or even two, if they're small, they may not have much of an impact in getting pregnant. With IVF overall, there's a 50% decrease in pregnancy success with hydrosalpinx, but some people still do achieve a pregnancy with hydrosalpinx. So
you would say mainly false?
I would say, oh yes, we're doing true and false. Yeah, that's mainly false.
Okay.
Actually, it probably is. That's totally false. Yeah, totally false.
I think what these questions show is that people are very well read, aren't they, to know about medical terms.
Yes. No, but I think, one of the things that I really enjoy in taking care of patients who are dealing with fertility issues is that it is the most well-educated, compliant patient population that I've ever met. And one of the things I really enjoy is questions like this, because it's a teaching moment. Oh, no, let me explain where this is coming from. And then just to see the, oh, aha expression on my patients' faces when I discuss these things, it's really, as an educator, I really feel I really enjoy educating people on what's going on, because I feel if you know what's going on and understand it, it makes it you're more involved, you're more knowledgeable, and I think it really enhances the experience in many ways. So I love these questions, but I think it's a lot of information. And typically when patients are given a small amount of information, So, they don't have everything at their disposal. So I think it's, but I love these questions. I think they're fabulous. But it's a teaching moment. No, let me explain that to you. This is not how it works. This is how it works. It's great.
Exactly. Brilliant.
Yeah.
How to decrease natural killer cells during transfer?
This is a tough one because natural killer cells are inherently a controversial topic. Many providers across the world do not believe that natural killer cells have any impact at all on fertility. So I think this is a very hard question to address. And I honestly don't know the answer to that because I don't think that natural killer cells actually impact fertility adversely. So, many people who do believe in natural killer cells as an important factor for fertility would recommend steroids and intralipids, infusions, and all of these things. And many people around the world do not think this is a significant topic and would not address it at all. So it's a tough one to answer.
Mm-hmm. It's true or false? Having an abortion affects your fertility in the future?
False. Absolutely. And this is something I feel very passionate about. I see many women and couples who have come in for fertility struggles, who have had an abortion in the recent or even very distant past, and have a huge amount of guilt associated with having had an abortion. And it is not going to prevent subsequent pregnancy unless there was an unusual complication associated with that procedure when it happened. But there's a lot of guilt associated with having had a prior termination. And it is not a reason why people are struggling now. But there's such a bad association and guilt associated with this procedure that many individuals feel compelled to connect that with their current situation, but it's absolutely false.
Thank you.
Yeah.
And what about being on the pill? Does that negatively impact fertility, true or false? False.
That's another one. So I don't know where that comes from either. I think that when individuals are on the birth control pill works by shutting down the menstrual cycle. And so sometimes when the pill is stopped, there may be a delay in return of menstruation. Sometimes there's a delay in return of menstruation because in the intervening time the individual is on the birth control pill, their lifestyle may be very different, and the lifestyle may contribute to cycles being irregular. So we can sometimes see this with, young girls who are put on the pill because their cycles may be a little bit irregular when they were younger, or very bad cramps when they were younger. And then in the intervening 10 years or so, they've become, very, very serious athletes, and their weight is significantly, or their body fat is lower. And when they stop the pill, they're not menstruating. It's not because of the pill, it's because of their lifestyle during that time. And so there are many other examples of that nature, but the pill doesn't make people infertile. It can either mask the development of menstrual irregularity. There may be a delay in return of menses, but it's very transient, typically.
Should have probably said all contraception, actually. I remember a doctor saying to me when we had my husband's infertility diagnosis, well, the good news is you don't have to take contraception.
Oh, that's, yeah.
I guess that's good news.
I guess that's good news. Yeah. I think, well, that's just another example of people saying things meaning well. And when you actually hear it, you think that's not a helpful comment, but
Yeah.
I appreciate the sentiment. No, I think that it's, there's also, other forms like an IUD does not lead to future fertility unless there was a infection or something associated, or at the time an IUD was present, there was a development of something. But the older IUDs, where the newer IUDs are not. I mean, they're wonderful. And progestin implants and all the other forms of contraception, they do not impact. They're all reversible contraceptive things. And so when you stop them, fertility should continue.
That's another thing you get. You probably do in the States as well. When you go for, I can't remember whether it's the 6 or 8 week checkup after you've given birth, they ask you if you're on contraception. And they asked me, and I said no. And they said, "Is that wise?" And I said, "Have you read my notes?" The baby is via donor sperm, so I don't need to worry. And then they got really embarrassed, and that was the end of the conversation.
Yeah, exactly. Well, but you're very knowledgeable about this, and you're also very clever with play of words, and you can sort of sit there, and I'm sure you did that knowing the effect of that question on the person you were talking to.
Well, you sort of just answered it, but after stopping taking the pill, and again, sorry, this really isn't true or false, it's more of a question, but after coming off the pill or any contraception, how quickly would your period likely come back?
Great question. It really depends on the form of contraception. So if you're on a contraception that doesn't affect the menstrual cycle, like a copper IUD, it's not going to have any impact at all. If there is something like a progestin IUD or a oral contraceptive pill, then it could be 6 or 8 weeks at the outset, I mean, the longest. Typically, it should resume fairly quickly after you stop it, but there may be a slight delay because the menstrual cycle may be somewhat suppressed. Clearly, it's suppressed with the oral contraceptive. It's somewhat suppressed with the progestin IUD. So it may take 6 to 8 weeks.
Okay.
Yeah, the longest. Yeah.
And again, a question: how do STDs affect fertility in men and women?
That's a great question. This is a really good question. So I will address the women. So it depends which STD you're talking about. So typically for women, the ones that are most damaging to future fertility are chlamydia and gonorrhea. Chlamydia and gonorrhea can both cause an infection in the uterus and fallopian tubes that can damage the fallopian tubes, leading to hydrosalpinx, if you will, but other tubal damage, which can certainly lead to a delay in getting pregnant or even to infertility based on blocked fallopian tubes. So those ones are the most damaging ones in women. And that's why, we routinely screen for chlamydia and gonorrhea, because if you catch it early, there's less of a consequence. The other
Sorry, on that, would people know they had it?
Good question. No. I mean, if you had chlamydia, you may not know it at all. It could be asymptomatic. Gonorrhea typically is symptomatic, but chlamydia can be asymptomatic. And it's an indolent type of disease that over time just can lead to more and more damage. So people may not know they have chlamydia. And that's why in America, you come in and are screened when you get if you're a sexually active female and you get your pap smear, the chlamydia culture and gonorrhea culture is done pretty routinely on every sexually active female. Yeah. I'm sure it's done in them too. I want to address HPV. HPV does not cause fertility issues. And that's another sexually transmitted infection that it's detected with a pap test or pap smear. But that does not have any adverse impact on fertility. In men, there aren't any.
Just on the HPV thing, that's very interesting point, because I remember a conversation when I was your patient. We picked a donor, and I had a test to find out that I am HPV negative, and he was HPV positive. So I think the sperm bank advised that we match with we'd pick a different sperm donor. And I remember you saying that you've had loads of patients in the past who have said, well, I wouldn't know if my husband was negative or positive. So how important is it to pick a donor who is or isn't, who isn't HPV positive?
I don't know. That's a very good question. I think that HPV is fairly ubiquitous. The method of contracting HPV, it's an intracellular organism, and the method of contracting it is by contact. So it's not clear that using sperm from a donor who is HPV positive would have any impact, because it doesn't to our knowledge, get transmitted in the sperm. So it shouldn't be an impact with a sperm donor. But I think that men typically don't know if they're HPV positive. Women are tested for HPV with their Pap test. And nowadays, it's pretty common to do typing of HPV. Is HPV present? And then which type of HPV is it? Is the high risk or low risk, or, is it the bad ones, 16, 18, 45? So I think that it's, in a partner, certainly men don't know they have HPV. So you don't know until, later it'll show up in the female. Or if there's genital warts, it's pretty obvious. In many cases, not all cases though. So I think it's it's a tough one to deal with, but it basically doesn't cause fertility issues.
Okay.
So I think that's, which is a good thing. And then the men are tricky, because I really don't think there's any significant impact of these diseases in men, except they can transmit them to women.
Mm-hmm.
So, mumps orchitis is something, so it's not a sexually transmitted infection, but mumps can really affect they can have a terrible impact if the mumps are in the testes. It can really affect the sperm production subsequently in men who've had mumps in their testes.
Mm-hmm.
So that's a tough one. But people are vaccinated for that one, so it should not be a big issue.
Yeah.
And then the other thing is like HIV and all those things, and those things are a whole nother category. They do not impact fertility per se, unless one partner is infected with HIV and the other is not. So there needs to be steps taken to reduce the transmission of infection. But again, nowadays with medications, they can reduce the HIV load. But in discordant couples, meaning that one individual has the HIV, the other doesn't, we would often do IVF, because you don't transmit the HIV with IVF. You can wash that. So that's how we would address that type of infectious problem. And it is transmitted sexually, so it's one of the things we check.
Periods, whether they're longer or shorter, does that mean that it's going to be any easier or harder to conceive?
The length of duration of the period, no. The timing of the period, if the cycles are longer or shorter, that can have an impact, because it may mean that ovulation is not occurring, regularly. So I didn't understand that question very well. So duration of the period or the length of
I think it's the duration of the period. I think it's whether you have a 3-day period or whether you have a 7-day period. Is that going to affect your fertility? Does that show you whether you're more or less fertile? That's how I read it.
So I would say generally no. However, if the period is longer because of a structural issue in the uterus, then the structural issue in the uterus leading for the period to be longer could impact it, such a polyp or fibroids or something like that. So that's a no, but possibly yes.
It could uncover something that might be worth investigating.
Correct. And especially if it's a new, like my periods were always 3 days and now they're 7 days. Like, this is new. What's going on? So that could indicate a condition in the uterus that is leading to that, for that to happen. That may not be a serious issue, but it could contribute to fertility.
Thank you.
That's a maybe.
Now we're getting to the good stuff. This section is lifestyle.
Okay.
Now I know you're not a nutritionist, but does vitamin D improve fertility?
Well, I would say no.
Sorry, true or false?
I answered a true or false
That's
before
false.
you asked me. No. But vitamin D is a funny thing. Everyone is vitamin D deficient. And I think that we're not out in the sun so much, people using sunscreen, all of those things. So everyone, is vitamin D deficient. And I think correcting vitamin D deficiency is important for overall health.
Mm-hmm. So it's worth everyone having their levels checked.
It's good. Yeah. And there's some studies say that vitamin D is important for for fertility success. Again, it's really hard to draw that conclusion, but I think that everyone should have a normal vitamin D level. I think it's a good health thing for bones.
Now, this question is something that I probably would have worried about. So I'm glad someone's asked this. Does staring at your phone or laptop at night impact your fertility? True or false?
No, it doesn't. However, it does make you more tired and cranky. And if you're not getting a good night's sleep, you're not being healthy. And so I think that for overall health, it's important to get all of those electronic devices out, because then you're less distracted and can actually go to sleep and get a good night's sleep. It's not the radiation from the phone or anything like that. It's just that it does disrupt your sleeping pattern.
And also maybe anxiety levels and stress and things like that.
Yeah, it does. I mean, you're reading about all this crazy stuff that's going on. It really, it's probably not good for anxiety right before you're going to bed. They say don't have a TV in your room, don't have all this stuff. Should be a safe haven to just go to sleep. Yeah.
True or false? Can you tell how good someone's fertility is by the condition of their teeth?
False. But this one made me laugh because my mother tells us all the time that the only reason one of the main reasons, I should say, she married my father is because he had really good teeth. And so this question, I just had to laugh. Like, did my mother send that question to you? I don't know. But no, I think, no, it doesn't. Yeah. It just means that kids are more likely to have good teeth.
Mm-hmm. Great.
Yes.
Thank you. Do sex positions impact whether you get pregnant or what gender you might conceive?
No, they don't. But that doesn't mean you should not have fun exploring those options. So they really don't. No one has ever shown that has a major impact. So I kind of feel like we've talked about this, but Sex Education is a wonderful TV show. And I feel like that's a question that would come up on that show. And I'm thinking to myself, was Otis ever answered that question? Let me see. I don't know. A lot of these things are based on the fact that female sperm that's carrying an X chromosome are heavier than sperm that's carrying a male chromosome, the Y chromosome. So but no, it's a nice thought, but no.
Okay. Are there any sex positions that you should avoid when you're pregnant? If you feel like having sex at all, that is.
Just avoid the ones that are uncomfortable. I mean, it's okay to have sex when you're pregnant. There's nothing wrong with that, unless there's issues with the pregnancy, preterm labor, or any other thing that would be not safe or unsafe. But anything that's comfortable. That's what I would answer that question. No, anything is fine as long as it's not uncomfortable.
Does using lube make it harder to get pregnant?
That's probably a no. However, there's always a no and however. It's really kind of funny, but there's sort of some of the lubricants may be toxic to sperm. So I think it's important to know what the lubrication is and is it toxic. And there's some that are marketed as being safe for sperm. And probably in low doses, most of them are safe for sperm. I think some of the studies have just used overwhelming amounts of lubricant with the sperm. And of course, that overwhelms the sperm. But in the doses that are used for intercourse, probably most of them are fine. There are some that may contain additives that may be harmful to sperm. So I think it's good just to look at which lubricant you're using.
Yeah. In fact, for anyone who's interested in that, in the shop section of Fertility Help Hub, there are fertility-friendly lubricants that you can try, which are in the UK and the US and other countries. So explore those if you want to go for a brand which is specifically tailored to trying to conceive.
Exactly. But I think that most of the lubricants that are have nothing in them. They're pretty bland, and they're for trying to conceive are safe. But there's some that you shouldn't use.
I presume you use lubricant, don't you, when you're about to do the scans?
Yeah, we do. And so it's water-based lubricant. And so it's not harm. When the doses that we use it, we put a small amount on the ultrasound probe because it really makes it much more comfortable to insert that into the vagina. So, and I think, but it's not harmful. I think, there's some of the water-based lubricants were found to be less friendly to sperm, but the way they did the test, they put sperm in a huge vat or amount of the lubricant. And if you overwhelm the sperm, they're not going to do very well. But
Mhm.
in the doses that people use them when they have intercourse, it's usually a small amount. And so it should not be detrimental. But there's some that have additives and all other things that may go in there that are not so friendly to the sperm.
Just
Yeah.
a bit cold.
One could warm them.
Okay, this question's a bit out there, but I'm going to ask it anyway because someone
Okay.
Does swallowing semen make you more fertile?
No, it doesn't. It really doesn't. The sperm is degraded in the stomach, so it has no impact on that. So no, that's a myth.
Thank you.
Yeah.
And eating yams or sweet potato, are yams the same thing as sweet potato in the States?
Oh, I don't know. I think they're different. Yams, and they're similar, but I think they're different. Yeah. Yeah.
Does that make you more likely, and TTC is trying to conceive, does that make it more likely when you're TTC to have twins, someone asked?
No, it doesn't. I think that yams, some of these may contain estrogen-like substances, and I think that's where that probably came from, but it doesn't. No, unfortunately.
Well, that concludes the questions for today. So thank you so much for people who sent them in.
It's a pleasure. No, it's really wonderful to see what questions people come up with. And, I think these are really good questions. And I think it's wonderful that you have the ability for people to ask these questions. Because as you said, sometimes it's really hard to find a straight answer, and it's really hard to just Google a question. So I think it's brilliant that you are doing this, because I think many people have these questions, and they're good questions. There's a lot of things out there that are, myths that people are being told is definitely truth. And I think it's wonderful to have a forum to discuss them. So I think it's great.
Absolutely. Well, thank you so much for your time today.
Well, thank you for having me. It's so good to see you across the pond.
You too.